we will be expecting to hear a lot about the vaccine that will be taking place this Saturday. 1,950 New Brunswickers will be receiving the first of 2 doses of the Pfizer vaccine. What happens with the Pfizer vaccine is it's a 2-dose process. The first dose happens, and then 3 weeks later you receive the second dose. So we do know that 1,950 people have been selected, and if you watch CHCO's news coverage this week, we spoke with Dr. Hanif Chatour. He's an emergency room doctor in Waterville, who is one of the first people to receive the vaccine this Saturday, and he did start the campaign #GotTheShot. So he is going about telling his story using that hashtag and encouraging other New Brunswickers and Canadians as well who are among the first to be vaccinated to share their stories online, just to demystify the experience for everyone. And he said he was very enthusiastic when he received the email this week that said he was eligible to receive the vaccine. So it was very interesting to hear his story and to know that he's going to be sharing his process along with New Brunswickers, and we do expect to have him back on a program next week to share his experience from this coming weekend with us and online as well. Now again, we should be hearing today if there is a new case count. We do know yesterday there were 51 active cases in New Brunswick at the moment. There has been a total of 567 cases in New Brunswick since the pandemic began. 507 of those cases have recovered, but again, there's 51 active cases, so there's still people who are recovering. We do know that in terms of who's in the hospital with the illness right now, there are 3 people in the hospital, 2 of which are in intensive care. Now I do see that Bruce, the moderator, is in the conference room, so that means we should be starting momentarily. And again, Premier Higgs will be joining us today along with Dr. Jennifer Russell. We do expect to hear a lot about the process of the first vaccinations taking place this weekend. As you can see, the sign language communicators are setting up, so we should be beginning any moment. And I appreciate everyone who does join us on CHCO. I follow, if you're watching on television, hello. If you're watching online, I'm watching your comments as they roll in as this takes place. So feel free to send me what your questions and concerns are. I follow as much as I can online as it's happening, and I'm still coordinating my question or 2. I don't know how many we'll be receiving today, but there is quite a large number of journalists in on today's conference. Usually there are when Premier Higgs isn't at all the conferences. When he is, there tend to be a lot of journalists that participate. So we should be hearing about the vaccine and how that process is going for New Brunswick. I know it's got underway in other maritime provinces already, but New Brunswick is starting the vaccination this Saturday in the Miramichi. Moncton has been chosen as the next location too. So we should be hearing a little bit more about that. As you know, the vaccine from Pfizer has to be kept at around -70, -80 degrees Celsius. That's the stored temperature it has to stay at. So there have to be special freezers for that process. So Miramichi Regional Hospital was chosen as the first location. Moncton is chosen as the second location because we will be receiving more vaccine shortly, and that part of that vaccine will be the second dose for the first group of people being vaccinated this weekend that they will receive in January when they do their second dose 3 weeks later. I do feel like I hear Bruce in the room, so I think we are starting any moment.
Speaking at this afternoon's briefing will be the following individuals: Dr. Jennifer Russell, the Chief Medical Officer of Health, and the Honorable Blaine Higgs, Premier of New Brunswick. Bon après-midi tout le monde et bienvenue à cette mise à jour sur le COVID-19 au Nouveau-Brunswick. Les personnes suivantes prendront la parole lors de la séance d'information de cet après-midi. Le Dr. Jennifer Russell, médecin hygiéniste en chef, et le Premier ministre de Nouveau-Brunswick, l'Honorable Blaine Higgs. Dr. Russell.
Thank you, Bruce. Merci. Bonjour à toutes et à tous. Good afternoon, everyone. Aujourd'hui, je discuterai des points suivants: l'éclosion au complexe Parkland St. John, l'éclosion dans la zone 4, soit la région d'Edmundston et de Grand-Sault, la façon de bien s'auto-isoler, l'importance de limiter les contacts étroits à sa liste des mêmes 20 et la première étape de notre programme d'immunisation contre la COVID-19. Today, I will be reporting on the Parkland St. John outbreak, the outbreak in Zone 4, which is the Edmundston Grand Falls region, how to self-isolate safely, the importance of everyone keeping to their steady 20 personal contacts, and the first stage of our COVID-19 immunization program. Another round of testing of Parkland St. John's Tucker Hall residents and employees was recently completed, and the results were that only one employee tested positive during that round, but another round of testing is going to be occurring today for employees and residents of Sims Court today. Therefore, to date, there are 20 confirmed cases at Parkland St. John, 8 employees, 1 non-Shanix employee, and 11 residents. Vendredi dernier, le cabinet a approuvé la recommandation de santé publique que la zone 4 retourne en phase d'alerte orange du plan de rétablissement. Nous sommes grandement préoccupés par l'éclosion à l'hôpital régional d'Edmundston et par la possibilité que le virus se répande dans l'ensemble de la collectivité. Jusqu'à présent, 13 cas sont liés à cette éclosion. Nous surveillons de près ce qui se passe dans la zone 4 et sommes encouragés par le fait que le virus ne se soit pas répandu davantage dans la région. Over the next several days, we will see how effective these measures have been in controlling the spread of COVID-19. I am very appreciative of the support the residents of Zone 4 have given to public health measures. Everyone who wears a mask in public places, practices physical distancing, and seeks testing for symptoms, no matter how mild they may seem, is playing a vital role in limiting the scope and duration of this outbreak. The staff at the Edmundston Regional Hospital are engaged in heroic efforts to treat COVID-19 patients and control the outbreak. They deserve our appreciation and support. I ask that the people of Zone 4 remain vigilant so we can return that area to the yellow level of recovery as quickly as possible. Je demande aux gens de la Zone 4 à continuer à faire preuve de vigilance afin que la région puisse retourner à la phase d'alerte jaune du plan de rétablissement le plus rapidement possible. Aujourd'hui, j'annonce qu'il y a 6 nouveaux cas confirmés de COVID-19 au Nouveau-Brunswick. Il y a 3 nouveaux cas dans la zone 4, soit la région d'Edmundston et de Grand-Sault. 2 personnes âgées de moins de 19 ans, 1 personne âgée de 40 à 49 ans. Il y a 2 cas dans la zone 1, soit la région de Moncton et du sud-est du Nouveau-Brunswick. Une personne de moins de 19 ans et 1 personne âgée de 60 à 69 ans. Dans la zone 2, qui comprend les comtés de St. John, Charlotte et Kings, il y a aussi un nouveau cas, soit une personne âgée de 40 à 49 ans. Toutes ces personnes sont en isolement et leur cas fait l'objet d'une enquête par Santé publique. Il y a présentement 55 cas actifs du COVID-19 dans la province. Et en tout, 3 personnes sont hospitalisées, dont 2 aux soins intensifs. Et quand on dit qu'il y a 50 cas qui sont actifs à ce moment-ci, ça, il faut les garder dans vos pensées, mais aussi tous les gens qui sont en auto-isolement, qui étaient des contacts étroits de ces 55 cas. Je vous demande une fois de plus de garder ces concitoyens du Nouveau-Brunswick dans vos pensées et vos prières. Today, there are 6 confirmed cases of COVID-19 in the province. In Zone 4, which is the Edmundston Grand Falls region, there are 3 new cases. Two individuals under the age of 19, 1 individual aged 40 to 49, 1 in Zone 1, which is Moncton and, 2 new cases in Zone 1, which is the Moncton and Southeast New Brunswick area, 1 individual under the age of 19, 1 individual aged 60 to 69. There is also 1 new case in Zone 2, which is St. John, Charlotte, and Kings counties, involving an individual aged 40 to 49. All of these cases are self-isolating and remain under investigation by public health. There are currently 55 active cases in the province of COVID-19, with 3 individuals hospitalized, including 2 who are now in intensive care. And I ask that you keep all of these fellow New Brunswickers in your thoughts and prayers, as well as all the people who are self-isolating right now. If you do the math, there are many people who will be self-isolating over the holidays, and so please reach out to them and offer them your support. After the year we have all had, I'm sure that everyone is looking forward to the holidays, and many of you may be wondering what to give your loved ones this year for the holidays, and I suggest that the best gift that you can give is the gift of safety. If you are planning to visit with family and friends outside of New Brunswick or are planning to have people visit you here, please ensure that everyone stays safe and healthy and that everyone is following proper self-isolation guidance. You can do that by planning for those 14 days of self-isolation before celebrating with others if a loved one has not yet arrived. And you know, the holiday season, whether you're celebrating Christmas or other celebrations, these may not be happening, but you can still have some other celebrations as long as they're very, very small. So don't let anyone bring COVID-19 to your festive table. I have heard from some of my counterparts in other provinces where people were not self-isolating properly, and that ended up causing the household to become infected, some of whom are elderly. So we just don't want that to happen. And I can tell you that all of my counterparts in Newfoundland, PEI, and Nova Scotia are all very, 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 very concerned about the holiday season. And we're very concerned about seeing increases in cases in the early January timeframe. So if we are all adhering to public health measures and staying as safe as possible, we will hopefully not see that spike in cases in those early days of January. Si vous prévoyez rendre visite à des membres de votre famille ou à des amis à l'extérieur du Nouveau-Brunswick, ou si des gens prévoient venir dans la province vous visiter, veillez à la santé et la sécurité de tous. Vous pouvez, entre autres, vous isoler pendant 14 jours avant de prendre part à une célébration avec des autres. If you are leaving the province, you will need to self-isolate for 14 days when you return. Certains pensent peut-être à contourner ou à tout simplement ignorer ces mesures. Nous savons par expérience que ce genre de comportement peut être tragique. La deuxième vague de la pandémie de COVID-19 sévit présentement dans la majorité du pays et il est possible de lier bon nombre de cas à des rassemblements du jour de l'Action de grâce ou des gens qui ne sont pas bien auto-isolés. Et quand je dis l'Action de grâce, on a vu aux États-Unis, leur Action de grâce était une couple de semaines passées, puis après ça, on a vu une grosse augmentation dans les nombres de cas aux États-Unis. Une pandémie, ce n'est pas vraiment un temps de voyager pour des raisons non essentielles. Alors, si vous pouvez éviter de voyager durant les vacances, c'est tellement important pour nous protéger comme une province. People may be thinking about taking shortcuts or disregarding measures altogether. We know from experience that this can result in tragedy. And again, I have had people even contact me asking for advice. So my family members are coming from a different province. Why don't I just self-isolate with them? No. That's not safe. You can get infected with visiting family members, and we don't want that to happen. And we know that that can result in very, very serious consequences, including hospitalization and including death. So the second wave of the outbreak of COVID-19, now engulfing much of our country, can, in many cases, be traced back to holiday gatherings for the U.S. Thanksgiving and our Thanksgiving, included, where people failed to self-isolate or had many large numbers of close contacts. So we know that gatherings are a risk, and we would like those risks to be minimum. And we don't want to see large numbers of cases in the January timeframe after the holidays, because we know that we'll see the effects of what people are doing within a 2-week period of those activities. It only takes one case of COVID-19 to start an outbreak. It only takes one case of COVID-19 to spread in a community and have many people affected. And so I implore you, I don't want anyone to get COVID-19. I don't want anybody to be in that position. The most effective way to self-isolate is to completely separate yourself from your loved ones for 14 days. If you can, stay in a rental property or a cottage or a hotel so that you do not have to have contact with others. If you are in the same house, it is very important that you make sure that you're separated from others at all times. There's no hugging, you stay 6 feet apart, you stay in different rooms, you stay in different bedrooms, you do not share a bathroom, you do not share meals together. You disinfect, you wear masks. It's very important. And if you do get symptoms, it's very important to get tested immediately, even if you have very mild symptoms. Please don't take it for granted. If you test negative, you should continue to observe the full isolation period to ensure everyone's safety. Some may believe that self-isolation means spending 2 weeks celebrating with family while the isolating person wears a mask and sits 6 feet away. That is not true. You would increase the risk of infecting your loved ones if you are carrying the virus. So please don't take any chances with COVID-19. It remains very important to keep your number of close contacts low, especially during the holiday period, and I know this is very, very difficult. I don't think we should be celebrating the holiday season the way we normally do. I think that if we're smart and we're wise, that means that when we are able to gather in larger numbers, that we'll all be there to be able to gather together. Stick with your steady 20, keep track of the contacts that you have. Make sure it's the same consistent 20 people, including your household members. When you're not wearing a mask, you're potentially being exposed and you're potentially exposing others. We don't want that to happen. Limit your close contacts, keep your mask on, and that's going to reduce the spread of infection so that we can avoid a surge of new cases in January. That is the whole point right now. We have some more messages about the vaccine coming up, which is very, very good news, but I don't want anyone to lose sight of the fact that we have to stay vigilant. The entire population in Brunswick won't actually be all vaccinated until later this year, probably within the next 6 to 9 months. So between now and then, we still have to stay vigilant, even for those who do receive the vaccine. Le premier lot de vaccins contre le COVID-19 est arrivé au Nouveau-Brunswick et les premières doses seront administrées en fin de semaine. C'est une situation très historique. Alors, on attend à samedi pour commencer à donner les doses du vaccin. Il s'agit d'une excellente nouvelle, mais il reste encore beaucoup de chemin à parcourir avant que nous puissions revenir à la vie telle qu'elle était avant la pandémie. In the opening weeks of the immunization campaign, the vaccine will be provided to those at greatest risk from the disease. And really and truly, the highest risk people, as you know, are residents who are in nursing homes, adult residential facilities, elderly, and frontline healthcare workers. So what we also know is that in the early days of our vaccine rollout, within the first 3 to 6 months, there won't be large numbers of doses available, not like our flu vaccine where we have about 350,000 doses. They come in a short period of time, they're given in a short period of time, and everything's done. Because these are new vaccines, we won't be getting a big, large amount of vaccines at once. And because there are many different kinds and they're complex in terms of the needs for transportation and storage, that is going to be why we have to prioritize very carefully what happens in those first 3 to 6 months. But certainly by that 6-month mark, we will get larger amounts of doses, more like the flu vaccine campaigns, and so the majority of the population at that time would be able to get vaccinated. But in the meantime, we're going to focus on our high priority groups with the small numbers of doses that we're going to be getting early on. So it'll be several months before the vaccine will be available to everyone who wants it, and my understanding based on information today is that all those who want to be vaccinated will be able to be vaccinated. I won't be among the first to receive that vaccine. I will take it when those most at risk have already been vaccinated, and I'll wait my turn where I fall in that priority, in those priority lists. And I'm not going to tell you my age because it does go by age. Protecting those in greatest need has been our objective throughout this pandemic, and this will continue to be our goal in the months ahead. Even with this beacon of hope, the holidays this year will not be what we are accustomed to, and when I think of the holidays and I think about what all families do with respect to their traditions, whatever those may be, whether it's around a tree, a dinner table, a church, a religious service, or what have you, many of us will not be able to have our families with us this year. And for many New Brunswickers, this holiday season may be a sad and lonely time. And I think lots of people suffer from mental health issues around the holiday season, regardless of the pandemic, but the pandemic certainly makes it worse. So please look after each other. Even if you can't be together, you can still reach out. You can share the joy of the holiday season and promise that we will all be together when we can have a green holiday, hopefully a year from now. On a personal note, I would like to thank the many New Brunswickers who have sent Christmas wishes to me and my staff. My office has received hundreds of cards and letters from seniors, families, school children, kindergarten classes, Girl Guides, Brownies, Pathfinders from every corner of New Brunswick. C'est vraiment touchant que des gens de tout alentour du province m'envoient des cartes de Noël, des cartes des gens de toutes les parties du Nouveau-Brunswick, des enfants, des étudiants, des plus âgés. C'est incroyable. C'est vraiment, ça me donne beaucoup de plaisir, ça me donne beaucoup de joie. Et j'ai passé tous les messages à mes staffs aussi. Some of the people in the letters have told me that they felt like I was one of their family over the last 9 months. And honestly, that was really, really touching. So I'm really grateful, and I just want to express my gratitude for everyone who's taken the time to write. Alors, je voulais vraiment remercier tout le monde qui ont pris le temps d'écrire des cartes, qui m'ont envoyé des cartes de Noël. C'est vraiment touchant. Il y a des gens qui ont mentionné qui sentaient que je faisais partie de leur famille. Alors, je voulais juste vraiment vous remercier pour votre générosité et ça m'a donné beaucoup de plaisir, beaucoup de joie et j'ai passé les messages à mes staffs aussi. So, my wish for all New Brunswickers is that we have a safe and joyful holiday season. Je souhaite que tous les citoyens du Nouveau-Brunswick passent d'heureuses fêtes en toute sécurité. And I know that we can all do this together and keep each other safe. So thank you very much.
Good afternoon. Bonjour. This weekend, New Brunswick will take a significant step forward in our journey through the COVID-19 pandemic. Beginning on Saturday, we will administer 1,950 doses of the Pfizer-BioNTech vaccine in Miramichi in priority groups that have been identified in our vaccine plan. We have received interest from priority groups across the province, including long-term care staff and residents, people 85 and older, staff from the provincial rapid outbreak management teams who go into the areas that have outbreaks threatening our most vulnerable people. Extramural, ambulance, New Brunswick staff members, healthcare workers, and First Nations nurses. Nursing home residents will be taken to the Miramichi Regional Hospital, and frontline healthcare workers are being given appointments to receive vaccine. Les résidents de foyer de soins seront conduits à l'hôpital régional de Miramichi, et les travailleurs de la santé de première ligne ont des rendez-vous pour recevoir leur vaccin. Residents and staff of Shannock's facilities in the Miramichi area were invited, as were staff of other long-term care facilities and adult residential facilities in the Moncton, Bathurst, and Miramichi regions. Les résidents et le personnel des établissements de Shannock's dans la région de Miramichi ont été invités, ainsi que le personnel d'autres établissements de soins de longue durée et des autres établissements résidentiels pour adultes des régions de Moncton, Bathurst, et Miramichi. We expect to reach 100% capacity at the clinic this weekend and will deliver all of the available doses. Next week, we expect to receive an additional 3,900 doses of the Pfizer-BioNTech vaccine. We will keep 1,950 doses of that shipment in reserve to provide this first group of people with their second dose during the weekend of January 9th and 10th in Miramichi. We will use the remaining 1,950 doses to administer the vaccine to 975 additional people during a clinic that has been organized during the week of December 28th in Moncton, where we also now have a freezer capacity. We will retain the other 975 doses for this group's second dose. We will be contacting people in the identifying priority groups soon to begin setting up appointments at this second clinic, including those who are unable to attend the first clinic. Nous allons bientôt contacter les gens de groupe prioritaire pour commencer à fixer des rendez-vous pour cette deuxième clinique. Les personnes qui ne peuvent pas se rendre de la première clinique feront aussi partie de ce groupe. This is only a first step. Ce n'est qu'une première étape. It's going to take many months. This is going to be a process. before enough of the population is vaccinated and we're able to move to the green level. We will work through the priority groups first, starting with the most vulnerable and those who work with the most vulnerable. But in the months ahead, everyone who wants a vaccine will be given the opportunity to get it. We expect to receive another 3,900 doses of the Pfizer-BioNTech vaccine during the week of January 4th, and we anticipate regular deliveries will begin the week of January 11th. We are also exploring options to acquire or borrow more freezers so that we can store the vaccine in additional communities. We have received several offers of assistance from businesses and organizations in our province and in our region offering equipment and support, including the use of special freezers and fridges. We are indeed very grateful for the generosity we have seen. This shows and continues to show how when it really counts, we all come together to do our part. Public Health has also been assessing existing capacity in the province. For example, the vaccine doses going to Moncton will be stored at an approved site identified by staff and has equipment and the capacity to store the vaccine. I am very confident we will continue to hear good news about additional vaccine, such as Moderna, that are expected to be approved for use in Canada very soon. This will help speed up access to all. While these first clinics are being held in Miramichi and Moncton, future clinics will be held at other locations throughout the province to ensure easy access. Les premières cliniques auront lieu à Miramichi et Moncton, mais les cliniques suivantes auront lieu un peu partout dans la province pour les rendre plus accessibles. Our province is well prepared to receive and distribute the vaccines once larger numbers of doses are available. Notre province est bien préparée pour recevoir et distribuer la vaccine lorsqu'un plus grand nombre de doses seront disponibles. For now, I ask everyone to be patient. What is so exciting is that just a month or so ago, we were all wondering when a vaccine would arrive. And now not only is it arriving, but there are multiple vaccines that are on the horizon, very close. But we do have to remember we are still in the midst of a global pandemic. We've had success thus far, and we cannot lose sight of where we are and that vaccines are just now being distributed. We cannot lose sight over this holiday period. We must continue to maintain our focus. We must continue to follow the mandatory order and the advice of public health. We have to follow the rules that are applicable to our health zones, whether we are currently in yellow or orange. Christmas is just over a week away, and I want to remind everyone that the same rules apply during the holiday season. And I know it's difficult. I know for me and our family, Christmas won't be the same as it has been in past years. If you are doing any last-minute holiday shopping, remember to wear a mask and maintain a physical distance of at least 2 meters. If you have gifts to pick up next week, consider buying local. The support for local businesses and the support for our province by residents has been overwhelming, and it's put us at the forefront in so many categories. Many local entrepreneurs, however, are struggling this year because it is a different time. And this is the time of the year when they usually make up for losses during the year. And this year it has been an exception. The holidays are the perfect time to support businesses in our community by purchasing New Brunswick-made gifts. We are so fortunate to live in a province where we can go shopping while taking precautions. Nous sommes privilégiés de vivre dans une province où nous pouvons aller en magasin, tout en prenant des précautions. We can even have small gatherings in our region if it is in the yellow level. Nous pouvons même avoir des petits rassemblements si notre région est dans la phase jaune. But this Christmas is not going to look the same as others. Mais Noël, c'est différent des années passées. If we don't make changes to our usual celebrations and take precautions over the holidays, we risk a surge of COVID-19 cases in January. We have seen it happen across the country. We cannot let our guard down. We've been diligent, we've been persistent, and we must continue until we have fully vaccinated, or we've reached the threshold of 70% of our population. The safest way to celebrate is to avoid large gatherings and keep your contacts low and consistent. Follow Dr. Russell's advice to stay within your steady 20. New Brunswickers are strongly advised to avoid all essential trips, all non-essential trips this holiday season. I know the restrictions in place have been hard for many, and this will be a difficult Christmas for those of us with loved ones living in other provinces or countries who cannot come home to visit. I have 2 daughters and their families, one in Ontario and one in Saskatchewan, who will not be coming home for Christmas. But these measures have worked well so far, and now is not the time to give up or for us to lose our focus. Please continue to step up and follow the rules as our vaccine rollout continues. Continuez à faire des efforts et à respecter les règles pendant tout le processus de distribution du vaccin. For now, Zone 4, the Edmundston region, is still in the orange level. Pour le moment, Zone 4, dans la région de Edmundston, est encore dans la phase orange. But if we all do our part, we can get all of New Brunswick back to yellow soon. Mais si tout le monde fournit sa part effort, nous allons pouvoir ramener toutes les régions de New Brunswick dans la phase jaune. Let's keep up the good work. Let's keep up the great work over the holiday season so New Brunswick is in yellow as we enter 2021, and we stay in yellow as we go through the vaccination process. Let's set the tone for the new full year. Let's ensure our new year is full of promise and hope and reinvention as we move beyond COVID and into a bigger, brighter future for our residents. Thank you. Merci.
Merci, Monsieur le Premier Ministre, Dr. Russell. Thank you, Premier and Dr. Russell. We'll now proceed with questions from members of the media. You have the right to pose your question in the language of your choice. Each reporter will have one question and a follow-up. Please ensure your microphones are placed on mute. Nous allons maintenant procéder aux questions des journalistes. Vous avez le droit de poser vos questions dans la langue de votre choix. Chaque journaliste peut poser une question et un suivi. Et s'il vous plaît, voulez-vous assurer de désactiver le son de vos micros. Travis Fortnum, Global News.
Hi there. I think my first question is best suited for Dr. Russell. Nova Scotia got their first doses of the vaccine on Tuesday as well, but they gave their first shot on Wednesday. I'm just wondering why we waited until Saturday.
Well, we have been planning our rollout for quite a while, and when we look at resources that we need to do that, we want our hospital capacity and our health service delivery system to function at a high level. So we know that to take extra staff and time, et cetera, then it's better to do it on a weekend. So that's why we chose the weekend for many logistical and human resource reasons.
Thank you, Doctor. Mr. Fortnum, do you have a follow-up?
I do. I'm wondering how many people are expected to get the shot on Saturday, or if it will be spread out Saturday and Sunday.
My understanding is it's spread out over Saturday and Sunday, and the total number is 1950.
Thank you, Mr. Fortnum. David Coach, Times and Transcript.
Yes, question for Premier Higgs. A longtime registered nurse told me that as recently as 2005, when she was the immunization nurse for Untitled First Nation, public health refused to vaccinate children from that Indigenous community during routine vaccinations at a public school in Rexton, because Indigenous children, they claimed, were considered federal jurisdiction. Now, the federal government says the provinces and territories are responsible for allocating the vaccine to all those within their jurisdiction, including First Nations. Are you aware of these alleged refusals to vaccinate Indigenous children as recently as 2005, and how will your government ensure First Nations will receive the COVID-19 vaccine?
Well, I can't speak to something that happened in 2005, but what I can tell you about the rollout for the COVID-19 vaccine is that we are partnering with our Indigenous communities and making sure, I believe that one of the high priority groups are the nurses that will be vaccinating the Indigenous communities here. So again, I can only speak to what we're doing right now with the COVID-19 vaccine with respect to First Nations.
Mr. Coach, do you have a follow-up?
Thank you. Respectfully, I was directing the question to Premier Higgs because we have put this question to the Department of Health several times, and I'm wondering if you are aware of these alleged refusals, and if we can get some answers from public health about this episode.
We're debating who should answer this. I'm not familiar with what happened 15 years ago, to the same as Dr. Russell said, but certainly, you know, we are identifying as a population, all vulnerable populations, and everyone will be treated equally based on the risk assessments, and certainly that includes First Nations and the community and the children. It's all part of vaccinating the entire population of our province. So I would anticipate and insist that everyone is treated equally and based on the vulnerability that exists, and I don't see any real reason to deviate from that.
Andrew Watt, Telegraph-Journal.
Thanks, Bruce. Dr. Russell, I'd like to get your thoughts on this. So we've got the Pfizer vaccine coming in, and then we got the Moderna vaccine coming in. Like, are they exactly the same? Are they different? Is one better than the other? Like, how does that work? I don't really understand.
So Moderna and Pfizer vaccines are mRNA vaccines, so they are a new technology in terms of vaccines. They both have requirements with respect to transportation and storage at certain temperatures. So the Pfizer one is minus 80 or minus 70, and the Moderna one is, I think, minus 20. And once those two vaccines are rolled out and provided for the higher risk populations that we've identified for the first phase of the rollout, the other five out of the 7 vaccines that we're expecting to receive are more traditional and don't have the same requirements with respect to the temperature and the storage. It's just a matter of when the other ones get approved, and the volume of them will be available to us probably only about 6 months from now. So we're prioritizing the higher risk populations to get the first types of the vaccines, and just to confirm that the Pfizer is one that has to be held at minus 80, and the one Moderna is supposed to be held at minus 20. So those have logistic issues in terms of the transportation and the logistics around where they have to be stored, and what types of populations in terms of their mobility, et cetera, will be accessible. But then once the more traditional vaccines arrive in much larger quantities, because that's the other thing, is the ones that are coming out about 6 months from now are going to be available in much larger quantities. And so much like the flu vaccine rollout, where we vaccinate 350,000 people within a several month period, several week period, we expect that once that part of the rollout happens, it'll go quite swiftly for the majority of the population that wasn't in the higher priority groups, based on age, based on risk, and based on working with high-risk populations and also critical infrastructure.
Thank you, Doctor. Mr. Watt, do you have a follow-up today?
I do. Okay, but I didn't really feel like the question got answered. Like the Pfizer vaccine, for example, they're saying, kids under 16 can't take it. Like, are they exactly the same vaccine apart from the need to store them at different temperatures, or are they different?
Well, they have different profiles in terms of efficacy. They have different profiles with respect to any adverse events. In terms of the phase 3 trial data and results of that, you are correct with respect to the Pfizer. There were only a limited amount of people under the age of 16 that we have data on for that. So although children aren't really in the first phase or the second phase of the rollout actually anyway, so I guess, with respect to who needs to be vaccinated first, children under the age of 16 aren't actually on that list. So they can wait for the more traditional vaccines that we're going to be getting in July anyway, just like the majority of the population. So the first 6 months are going to be Moderna and Pfizer for the most part. And again, small numbers of doses, but we're going to hit the higher risk populations in terms of long-term care facility residents, healthcare workers who work in those facilities, healthcare workers who work with COVID-19 patients in units, and then we'll work our way down that list. But certainly if you're a healthy person and you're not in one of those priority groups and you're under the age of 55, you'll be in that group that will get the bulk of the traditional vaccines probably around the June-July timeframe.
Thank you, Doctor. Laura Lyle, CTV.
Hi, thank you, Bruce. This question would probably be best for Premier Higgs. Premier Higgs, are you hearing about or people running into or expecting to run into any transportation issues as far as it comes to, when it comes to people going out to get the vaccine in Miramichi? And are there plans to set up clinics like this in other parts of the province apart from Moncton?
Yes, there are plans to set up clinics all over the province as the vaccine becomes available. So no one should be concerned about access. And I think this is, in many ways, this is just the first phase in Miramichi, and you can see that what's been put together here on this weekend blitz is really vaccinating, 2,000, almost 2,000 people on Saturday and Sunday, and so it's not just a test and vaccinating one or two people. It's actually rolling out the vaccine, and as the deliveries come, another location set up in Moncton, as I stated earlier, and then as the other vaccines come and they have other different storage requirements, as discussed with Moderna, it makes it easier to set up other locations throughout the province. So everyone should have a comfort level about vaccines are here, they're rolling out, and we'll administer them as efficiently can, but distribute them throughout the province in centers that people can find easy ways to access.
Thank you, Premier Ms. Lyle. Do you have a follow-up?
I do, thank you. We've seen some other provincial health agencies name the first person who's going to be receiving the first dose of the vaccine. Does New Brunswick have someone specifically selected to get that first inoculation?
I think the answer is yes, but I am not aware of just who that is at this point, and I guess it will be disclosed on the weekend.
Thank you, Ms. Lyle. Thank you, Premier Marie Sutherland, CBC.
Hi, yes, my question for Dr. Russell. You said that you were going to wait your turn to get the vaccine in terms of the priority and age breakdown of the groups, but will you be recommending that Premier Higgs, Minister Shepherd, and members of the All-Party Committee be vaccinated early to avoid any continuity of government concerns?
That is a very good question, and as part of the critical infrastructure group, it's possible they will be included in that. But we're comparing. The priority groups do include people of a certain age, and I don't want to disclose anybody's ages, but between ages and between critical infrastructure needs, they will be vaccinated at the appropriate time that meets those.
Ms. Sutherland, do you have a follow-up?
Yes, also for Dr. Russell. So on December 11th, when you were asked if there was a chance of people in the Edmundston region celebrating the holidays at the yellow level of recovery, you said never say never, and today you sort of indicated you're still very concerned. So what are your thoughts today about the chances? We've got, like a week to go. What would it take to get them there?
Well, I think we have to watch and wait, just as we have in every other situation where a zone was in the orange phase. So we're doing the same process that we've done in every single situation like that. We look at the data, we look at the type of transmission that we're seeing, we're looking at the hospital capacity, the impact there, we're looking at, are people following public health measures, et cetera. So I'm cautiously optimistic right now, but again, anything can happen over the course of the days that, as soon as you get a new case, again, doing the contact tracing, is it somebody that was already on the list, how many people are self-isolating, et cetera. And, again, it is somewhat unpredictable, but as of the trends right now, I think we're cautiously optimistic. That's all I can say right now.
Thank you, Ms. Sutherland. Vicki Hogarth, Charlotte County TV.
Thank you, Bruce. My question is for Dr. Russell. Dr. Russell, what percentage of New Brunswickers who've been offered the vaccine this weekend agreed to take it, and what has the general feedback been from those who've been offered the opportunity?
So, with respect to the Pfizer vaccine and the Moderna vaccine, that rollout is going to be in the next 3 months approximately, and very, very small numbers of doses. So, you know, we have a population of 750,000 roughly in this province, so 1950 out of 750, that's not a very large percentage. It's really a drop in the bucket. But as we move further through the rollout, as the other vaccines become available in larger quantities, the rollout will go much quicker and much faster, again, with the general population. But early on is small doses, small numbers of doses rather, small percentage of the population, but those at highest risk in the population, including the healthcare workers that will be working with the high-risk populations.
Thank you, Dr. Ms. Hogarth. Do you have a follow-up?
Sorry, my question was actually what percentage of the people who were offered the vaccine this weekend agreed to take it?
Oh, I don't have that number, but I'm assuming that there would have been at least 1,950 invitations that went out in terms of, and if they didn't want it, I don't know how many would have said no. And if they did say no, you know, I wouldn't know the reasons why. My understanding is I think all the people that are being offered it are planning to attend, but that can change between now and the weekend.
Thank you. Margot Castada, Akobari, Radio-Canada.
Oui, cette question est pour le Dr. Russell. Est-ce que vous pouvez faire le point de manière un petit peu plus précise sur l'éclosion à l'hôpital d'Edmundston? Vous avez dit qu'il y avait 13 cas qui étaient liés. Est-ce qu'on pourrait aussi avoir le nombre de personnes en isolement?
Je vais essayer de trouver cette information. Je sais, dans la zone comme telle, il y a 17 cas. Et oui, dans l'hôpital comme tel, 13 qui sont liés. Les employés, il y a 9 employés qui ont testé positif, je crois, et les autres étaient des patients. Mais je ne vois pas... Ah, il y a 55 staff de Horizon et Vitalité qui ne sont pas au travail. Alors, il y a 37 qui ne sont pas au travail de Vitalité et il y a 18 qui ne travaillent pas de l'Horizon, le réseau Horizon.
Margot, as-tu suivi?
Oui, je sais que vous avez répondu à cette question en anglais. J'aimerais la reposer en français si vous voulez bien. Quel est l'espoir pour la zone 4 de passer Noël en phase jaune? Ah, OK. Alors, comme chaque éclosion dans chaque zone qui a déjà été en orange, le protocole, c'est le même. On surveille les informations au fur et à mesure qu'on les a, les nombres de cas. Est-ce que ce sont des cas qui sont liés à des contacts étroits qu'on connaissait déjà? Est-ce qu'il y a un impact encore sur la capacité de l'hôpital? Est-ce qu'on voit de la transmission dans la communauté? Et est-ce qu'on voit que les gens suivent tous les protocoles, les directives de santé publique? À ce moment-ci, je crois que on va essayer d'être capable de faire des décisions dans les prochains jours, mais d'habitude, c'est 14 jours qu'on peut voir les changements. Mais comme le cas de zone 3, on avait fait des changements avant le 14 jours. Alors, on va voir on va voir au fur et à mesure les prochains jours.
Merci, Margot. Meg Cunningham, CHMA News.
Good afternoon. My question is for Dr. Russell. Can you walk me through the steps from start to finish that a person would have to take to visit a friend or a family member for the holidays in a different province in order to do so safely and within public health guidelines?
Well, I think all of my colleagues across the country would say that non-essential travel is not advised. So going to visit a family member or a friend is non-essential travel and it's not advised. So that's the number one point that, again, my colleagues across the country, including the Atlantic bubble, have been messaging to their citizens, to their provinces. We want to get through the holiday season as safely as possible so that we don't see spikes in January. We are really, really concerned that gatherings over the holidays and travel over the holidays will contribute to that. So that's the first and foremost thing, is there are risks right now to traveling because the numbers are so high all across this country and all across the U.S. So there's not really a safe place that you can travel from that we wouldn't be concerned about you arriving here. If you do choose to come to New Brunswick, you need to self-isolate for 14 days, and you need to do that self-isolation as safely as possible. The safest way to do the self-isolation is to rent a place or Airbnb, a hotel or whatever, stay in a location by yourself. If you have to self-isolate in a household with other people, you must have your own bedroom. You must have your own bathroom. You must eat your meals separate from the rest of the household members. You must stay in a different room from them. You must wear a mask at all time. You must disinfect. There is a safe way to do it, and if it's done safely, then people will be protected. But if there are any shortcuts taken or any errors made, the risk to the household members is there. And we just don't want to see that happening over the holidays, and we certainly don't want that to contribute to increased numbers of cases in January.
Thank you, Dr. Ms. Cunningham. Do you have a follow-up?
I do, thank you. So based on what you just said, it sounds as though you're saying that while it is technically permitted to travel interprovincially, you are discouraging it?
Absolutely.
Thank you. Bobby Jean McKinnon, CBC.
Yes, thank you. Premier Higgs or Dr. Russell, I know the second shipment of vaccine is expected to arrive next week, which is why you decided to administer all 1950 doses rather than save half as second doses for 975 people. But what happens if something goes wrong and the second shipment doesn't arrive within the required 21 days for the 1,950 people to receive their second dose? What is the contingency plan?
So Greg McCallum would love to speak to that because there is a contingency plan. Certainly, we do expect there to be always the risk of delays. So there is a window whereby, as long as we get the shipment in by a certain time, that we can accommodate that without losing its effectiveness, et cetera, with respect to the timing of that second dose. But if there are any extra details on that I'm missing, I will check with my colleague Greg McCallum, and Bruce can help you relay any extra details that I may have left out.
Thank you, Ms. McKinnon. Do you have a follow-up today?
Yes, I do. Thank you for Premier Higgs. Some paramedics, nurses, and other healthcare workers who were deemed priority for the vaccine were invited to apply to attend the clinic in Miramichi this weekend and were given appointments, are now being denied time off to go because of staffing demands and travel times. Unions and the opposition say these frontline workers should be accommodated. They say this problem should have been anticipated, and it's up to you to fix it for this group and for others going forward. How do you respond?
So in terms of the rollout, my understanding is that because that high priority group is going to be rolled out over the next 3 months, there will be many opportunities. And as I said earlier, somebody asked a question about why we were delaying it till the weekend. We are trying to not disrupt anybody's need to work. We're trying to make sure that health service delivery is provided at the maximum capacity and not interrupt that. So we're trying to be very, very judicious and balance those things. There will be other opportunities, and certainly, again, many more doses are coming from Moderna and Pfizer over the next 3 months for that high priority group. So if they don't get this batch or the one next week or the one the week after that, sometime obviously in the next 3 months they would have access to an opportunity where they weren't working to be able to get that vaccine as they are in that high priority group.
Thank you, Doctor. Thank you, Ms. McKinnon. Michael Staples, Daily Gleaner.
Thanks, Bruce. My question is for Dr. Russell. Health Canada issued a warning Wednesday about the risks of buying COVID-19 vaccines sold on the internet. What's your reaction to that, and what advice can you offer New Brunswickers about that?
Well, obviously safety is our biggest concern, and obviously we can assure the safety based on all the research and efficacy and data and all the work that we've done logistically to make sure that the supply that we receive is safe. So I would definitely discourage anybody from getting a vaccine off the internet.
Thank you, Doctor. Mr. Staples, do you have a follow-up?
I do a very quick one. Thanks, Bruce. Are you aware, Dr. Russell, of any incidents in New Brunswick involving false vaccines making their rounds?
I have not heard of anything like that happening, but obviously that's concerning if it were to happen, and obviously we would be very concerned about what types of things could happen.
Thank you, Mr. Staples. Thank you, Dr. Adam Harris, Telegraph Journal.
Thanks, Bruce. Question for the Premier. Premier, the federal government announced today that New Brunswick will receive $92 million more in transfer payments this coming year, including $64 million bump in equalization. You were worried about that being reduced. Could I just seek your reaction?
Well, yes, that's exactly right. I was concerned about it being reduced, but not only for particularly this year. I mean, this would seem to be shaping up like an election year, so I wasn't so concerned about it being reduced right at this time. But in future years, and given kind of the economy of the country, I am very concerned about the longevity of the transfer payments as we now know them.
Thank you, Premier. Mr. Harris, do you have a follow-up?
Yes, please, Bruce. On the same subject, it's a 3% bump in equalization. Last year, that bump was 9%, 8% the year before. What does it mean to New Brunswick's fiscal standing and the ability to deliver services like healthcare and others if the percentage increases are smaller?
Well, we know that this is all very relative. Our proportion is like 35 to 40% of our total budget. So my point in any discussions that I'm having, whether it be through the negotiation process, is the reality that we must find a way to ensure that our services are continued to be enhanced, not alone be threatened by a lack of financial resources. So it is concerning that if we have provincial costs that grow faster than what this portion of 40% of our budget would be growing. That's why the provinces have been talking about and united on the continuous funding for the health transfers, because we need to get back to a stable funding model that is more representative of what the federal portion should be. And so that's why we've been so insistent there, because we see those escalating costs that are going up faster than the current level of support. And that same logic applies for the equalization payments. And it becomes even more of a concern for the equalization payments because if you look out over, like Alberta and the situation with the economy in Alberta, they too could be a recipient of transfer payments coming forward or equalization payments. That changes the formula dramatically. So if we're not keeping up even today to the inflationary rates, and then you have more recipients involved, then the formula, it becomes very concerning, and that is the longer term view. So looking out over the next several years, not just next year.
Thank you, Premier. Ria Fredet, l'Acadie Nouvelle.
That concludes today's COVID-19 update for New Brunswick with Premier Higgs and Dr. Russell. Just for a recap, there were 6 new cases of COVID-19 in the province today. 3 were in the Edmundston region, 2 were in the Moncton region, and 1 was in the St. John region. We also heard a little bit about the vaccine that's underway this weekend. 1,950 New Brunswickers will receive the first shot of a 2-dose vaccine from Pfizer this weekend in the Miramichi. We'll see you next time on the COVID-19 update for New Brunswick here on CHCO-TV.
A news and public affairs production of CHCO-TV, New Brunswick's only source for independent community television.